tell me when you quit hearing the tuning fork when I put it on your bone, and then when you're done, then I'm going to bring it in front of your ear, and you're going to listen and tell me when you can't hear it anymore. Okay? Her air conduction is greater than bone conduction. Now I am going to do the Weber test, and I would like you to tell me whether or not there is any sound, lateralizes to either one of your ears. It does. Okay. So when doing the Weber, the sound lateralizes to her right ear. Okay? But based on a positive whisper test and an air conduction greater than bone conduction on Renee, the cranial nerve 8 seems to be intact, but you may want to have her referred to a ears, nose, and throat to have her hearing checked with the lateralization to the right ear. Okay, so we're done with doing both of them is a bonus. Doing one or the other is what you can do to just for the basic essentials of the checkoff. Now we are going to examine the nose. We're looking at the nose to see that it is symmetrical, it's midline, it appears to be intact, and then you palpate it to make sure the structures are intact and the structures of her nose are intact. Could you please place your finger and breathe in and out? And the other nostril. Okay. Her nares are patent bilaterally. Now we are going to examine the nares to, this is the funnest part about the whole thing. Okay, if you could tilt your head back for me to make sure that they're pink, there's no swelling, there's no discharge, and the septum is intact in midline. For a bonus, you can have them smell 2 different aromas, one for each nostril, and if you could close your eyes and occlude one of your nostrils, okay, and tell me what it is that you're smelling. Yes. And then for the other nare, another aroma. Okay. So you pick whatever it is that you're going to be testing. But so she has, so cranial nerve 1 is intact because she could identify both of the aromas that she was assessed with. Now we are going to assess her mouth, and you might not need a tongue blade, but a lot of people can't open their mouth wide enough to be able to really get a good visualization of it. So if you could open your mouth for me. Her mucous membranes are moist. Her gums and mucous membranes are pink. Seem to be in good repair. No lesions or masses. Could you lift your tongue? There you go.
Can I reverse it?
Oh,
sorry.
Why are you not breathing?
Because I don't want to breathe in your face.
You bring minutes, okay? Because that's one thing. I was going to bring minutes today, and I didn't breathe either. But I'm talking, so she's probably having to breathe and smell me. So I apologize for that. But, okay. The soft and hard pellets are intact. Okay. Could you stick your tongue out for me? Her tongue can protrude midline, and it's pink, and it's symmetrical on both sides. You say ah. Her soft palate raises symmetrically, and her uvula raises midline. And you have a gag reflex? Okay. She has a gag reflex intact. That's verbalized. So we don't want them throwing up on each other. And so that the gag reflex being intact and the uvula raising midline and the soft palate rate of 18, and it's even, and it's unlabored. Her thoracic cavity there's two apical, anterior to posterior diameter is half the size of her transverse, so it's a 2-to-1 ratio. It's symmetrical in movement. Both sides are moving together equally. And now I'm going to palpate her trachea. See if there's any pain at all. The trachea is midline and intact with no tenderness. And now if you could